So this is a good question. What about if it's in the tail of the pancreas? And what we're talking about is pancreatic adenocarcinoma. She's asking, what are the symptoms? Okay, so I get so many questions on pancreas and anatomy and symptoms and things like that. I decided to take time today and draw the entire area, and we're going to go over it right now. All right, so this is a drawing of the area. We're going to go over the anatomy. This is the abdominal aorta, celiac trunk, splenic artery, hepatic artery, common bile duct, main pancreatic duct, and then this is, of course, the pancreas itself. This is the spleen, and this is the first part of the small intestine, okay? And I've drawn it as a cutaway here so that you can see the ampulla. It's called the ampulla, where the pancreatic duct and the common bile duct can release digestive enzymes here. And the pancreas I've drawn as a cutaway. So this is kind of like the surface, and then this is a cutaway to show the head here. Now, most of the pancreas cancers we're talking about, and we are talking about adenocarcinoma, that's the most common and most lethal kind, arises here in the head. But the question is, what about if it arises here in the tail? Well, first of all, let's go over the different regions of the pancreas. So this is going to be the head right here, and then this little bump at the bottom is called the uncinate process. Then this part is called the neck, and then there's the body of the pancreas, and then the tail of the pancreas, which bumps up against the spleen here, okay? So the most common area is going to be here, and you can see that if a mass is growing, it's going to do a couple of different things. One is it's going to block off this common bile duct, which causes bile to back up this way, back up into the liver, causing that jaundice, that painless jaundice, and itching and things like that. And then, of course, if you block off the main pancreatic duct, then you can have digestive enzymes backing up into the pancreas, causing pancreatitis, which can cause that abdominal pain that's in the top of the abdomen and then can shoot through to the back. That's what it feels like. Okay, so the main area that you see it is here. About 70% of cases, you'll see a few maybe here and here, but 20 to 25% are in the body and the tail of the pancreas. And the symptoms here are a little less specific. You're going to get abdominal pain, you're going to get weight loss, and the other thing is maybe left flank pain, okay, so like the side of your body. But the problem with tumors that grow here is that they can grow much larger without being discovered, whereas a tumor that's well placed here may produce that jaundice early and allow localization and excision of the tumor itself in the Whipple procedure. So I'm a big proponent of knowing anatomy really well. To be honest with you, I get a little irritated when I have a medical student come through and they don't know anatomy very well. I think we should all know anatomy very, very well, all healthcare providers, because the anatomy dictates a lot of the times what the symptoms are. And in the case of pancreatic cancer, that is the case. So if you're out there and you're interested in studying medicine of any form, know your anatomy. It's going to help you, and it's definitely going to help the patient understand.